as I was listening to Karen, thinking about stigma and how there is so little understanding of mental health, mental illness, and so few people who are there to support a family or an individual who's going through that problem. So I'm hoping that it'll get better. Paula, could you join us?
Let me introduce you to another special lady. Paula, after her first child, had recurrent depression. And then after her second child, had another severe postpartum depression. Thank you, Paula, for the courage of being here today.
Thanks.
You have a few new friends out there.
Yeah.
Paula, you are a successful professional. You have a loving husband, you have 2 beautiful kids, and you have almost what everyone else would want in your life. Do people like you get depressed?
Yes, they do, in theory, but of course when it happens to you, it spirals out of control. You really, it's that feeling that this cannot possibly be happening to me. You know all the warning signs, because I'm a social worker. I have had a mother who went through depression, so you know all the signs, but it's that constant feeling that this cannot possibly be happening to me. And again, that's probably why I waited so long to get the help that I needed. After my first son, I knew the signs, I knew what I was going through, but it was painful and it was shameful. I was ashamed to acknowledge and to accept that I needed help. I was no longer the helper, I myself needed help. So
that's a difficult place to be. Good and competent mothers, successful professionals, when they get clinically depressed, there can be a terrible feeling of being inadequate and like you're at the end of your rope.
Absolutely.
Have you been there?
Absolutely. With my first son, I vividly remember getting back from the hospital, sitting in his nursery and absolutely bawling. Being out of control, just this lack of, here I am with this beautiful baby boy, absolutely healthy, and why can't I just be happy? That constant, why can't I just be happy? I have a wonderful husband who's supportive, and again, just, it wasn't there. It was, I would hold him, but it was this lack of, connection. And, again, you go back to schooling, that importance with connecting with your child, that eye contact, so important. And all I could do was just dread it. I dreaded getting up. I dreaded changing diapers. I dreaded it all. And I just vividly remember, this is what you wanted. You wanted kids. You wanted this. And it just, my heart was not in it. And it progressively got worse. And with my second one, it was the same thing. It was just, that is what definitely did me in. I mean, just three months after having him, it was just, I was ready to leave. So,
even though you intellectually and in your heart loved your baby, did you find it in the midst of depression hard to find the feelings of love?
Absolutely. It was all mechanical. It was all this idea that this is what it needs to be, but my heart just, it wasn't there. It wasn't there. And I think that feeling just, it kills you. It kills you because, this idea that we have of what mothers should be, and you should be excited, and, this is what society tells you. And even within the profession, this is what we tell the parents that we support, that it's so important, yet I myself could not do it.
Those feelings are still fresh. We can see that.
Absolutely. My baby's only 8 months old, so this is all very fresh. I just got diagnosed. I just, was in Alberta Hospital not that long ago. So it's all very fresh and,
What type of hope and help did you find in starting the healing process?
I was, as a social worker, sometimes we're cynical and the system is what brings us down and whatever, but I went to the emergency room because it was either I leave here and do something absolutely horrible to myself, or I get the help. And they were absolutely amazing, and thank you. So they they got me the help that I needed. I ended up at the Alberta Hospital after one day at the Royal Alex, and which I must say their mental health team was amazing. And then I went to the Alberta Hospital, and I remember getting there in the ambulance and being like, I cannot believe this is happening to me. And there is nothing worse than being conscious of losing your mind, like being able to, and even when you get there, they look at you, you look fine, you know, and even other patients, so what are you in for? And you're like, you know, so-and-so, and they're just like, well, you don't look it. It's exactly that, I don't look it. And I can still articulate myself, and I can still, you know, function, you know, quote unquote, even though I look like I'm functioning, but I wasn't. And again, I had amazing support. They didn't just chalk it up as being, you know, postpartum, you'll get over it. After that, I shortly was diagnosed with bipolar type 2. So, again, answers to, you know, years of not feeling well. And yeah, Dr. Lee and another doctor she was totally amazing, and I really do appreciate the help that I've gotten.
Well, we've been part of a team, and a team with other hospitals as well. It's not just our own, and thank you, Paula. We're grateful for being partners. I wonder if you could just speak for a moment. After your first baby, you didn't realize that you were going through a depression completely, and that you could receive treatment and help. Looking back, how do you feel about that?
I feel like I should have gotten the help then, because it probably would have saved a lot of years of anguish and you know, confusion and whatnot. But again, that stigma, it's the stigma that got me. It was this idea that it could not happen to me. This is not me. And you know, I struggled, and I did some things that I should not have done. And you know, looking back, I could have just. I could have gotten the help that I needed, but I didn't. So.
And that story is repeated many places. I wonder, Paula, in the last 30 seconds here, there is a leadership community of people who really do care and they do want to help. I wonder if you could take 30 seconds and just share, what would you hope to see happen for families who have been going through and gone through what you've been through?
I guess as a society, we really do need to work on the stigma. We, you know, we're all aware that it touches all of our families at one point or another. So there really needs to be this understanding that it can be your wife, your husband, your sister, your daughter. You know, we have real faces. We are struggling, and if only we had one person to just say, I'm here for you. We can do this together. A lot of years of feeling alone and pain could have been probably avoided. So I guess it's just, in sum, it's this this need that we need to get past this stigma. We think we've come a long way, and we have, by far, we have. But I still think that we have a long way to go, and we need to make sure that we support the people that we love